Hello ladies and gentlemen, Kevin Lucas with Structural Innovations and Relief Through Rolling, and I'm really excited to be inviting you to participate in our free webinar. And what we're going to be working on today is we're going to be teaching you the relief through rolling techniques for rolling the back and working the chest to be able to help alleviate a huge amount of issues for the whole entire body. Yes, by rolling the back and getting the back more functional and getting the shoulder girdle to be much more functional, we're going to be able to help decrease back pain, neck pain, shoulder pain, thoracic outlet syndrome. We're going to be able to address hip pain, all of these different things, because the spine is what connects the top end and the bottom end together. All right. One of the things that we have to understand as healthcare providers is that we need to be able to provide our clients with the opportunity to be able to address aches and pains or tightness or any kind of issue as our clients are having it. It's a really unfortunate thing when someone has something going on and they have to wait a week to see their massage therapist, or they have to wait, a couple of days to get it into their chiropractor. Being able to have that tool in the moment when you're uncomfortable can be the difference between something being minor and addressing it when it's really small, or it getting out of control. A really good example would be is if you had a small little fire on your stove and you can get your baking soda and put it out, or you get your fire extinguisher, or you have to wait to call the fire department, and by that time your whole entire house is on fire and you have a lot of damage. So with the relief through rolling method, our whole goal is to be able to support what you're doing as the healthcare provider and giving those tools to your clients, so in between their sessions or them being able to manage themselves, that's going to be the big picture change, and that's actually going to drive a huge increase in your ability to help your patients as well as grow your practice, because now that you're teaching your clients to fish, they're going to be so much more appreciative that they're going to refer more clients to you. So let's get right into the neck and the back technique and opening the chest with the relief through rolling method. All right, so what we're going to do right now is I'm going to talk about the difference between treating the symptom and treating the problem. And that's the whole goal of the relief through rolling method, is that we want to be able to give our clients a tool, whether you're a massage therapist, chiropractor, physical therapist, personal trainer, yoga or Pilates instructors. So many people are getting really great therapy from clinics and practitioners all around the country, but what's happening is that people still have their job, they still have the activities that they do, and in between their sessions or in between their workouts or in between their treatments, what can happen is that they can start to have an issue that starts to come up, and they don't really have a tool other than just traditional stretching to be able to manage that. And or they have tools that are actually structurally taking the body apart, meaning that the stretches or the other foam rolling techniques that they're using are actually doing a disservice to the structure, causing the body to go more out of alignment, and then a lot of people still have the same aches and pains because they're structurally not addressing and repositioning all of our pieces and parts and putting them where they're more functional. So in this free webinar today, we're going to be talking about how to be able to address the back and roll the back, and a big piece to that, which a lot of people don't understand, is that we have to look at the front of the back, because everything's connected in our entire structure. As we have our skeleton here, this is just an example of the bony tissue inside all of this amazing soft tissue. The muscles, the fascial tissue, the nerves, the organs, all of these other pieces and parts are all interwoven and connected together. And that fascial system is what's really responsible for positioning a lot of these pieces and parts, whether they're in the more correct position or whether they're in a position that's actually causing the structure to deteriorate. So what we're going to do is we're going to look at, from a structural standpoint, how the front of the body can drastically have an impact on the back of the body. So back pain, neck pain, headaches, trigger points, thoracic outlet issues, carpal tunnel-like symptoms emanating from thoracic outlet syndrome, low back pain, mid back pain, respiration issues, your ability to take air in and out, because this rib cage is so tight, or the back muscles are so tight, the ribs can't extend and float like they're supposed to. So when we're looking at this body, what we need to understand is that more of the back is determined by what's happening in the front of the body. So here we have Christopher. Christopher is a young, healthy athlete who actually participates in soccer at about 25 to 30 hours a week. He's on a national traveling team. His team is playing for nationals for the 4th year in a row. So you can imagine the amount of stress that goes on this young man's structure, and a lot of the back pain, neck pain, low back pain, hip pain he can be having, and a lot of that stems from what's going on in the front right here. So if we look at this body, and if we understand that how the pec major, pec minor are working in this region, the rectus abdominis is in this region, well, if this tissue starts to get tight and short and he starts to round forward, we can even see it just in the shirt right here, how all of this tissue starts to wrinkle together, and then in the body that starts to vacuum pack down. That fascial tissue starts to get real sticky, the muscles start to shorten, the fascial tissue shrinks down even more and glues that together there. Well, as he's in this, what we call ventral drag and medially rotated shoulder girdle and kyphosing, what that does to the back is that when he turns this way, that significantly rounds and elongates the thoracic spine. It takes the shoulder blades away from where they're supposed to be, and we have a huge amount of stress that develops right through here. Trigger points, not all those things that we try to address as healthcare providers. This is never going to go away, and this is never going to change no matter how many treatments people are getting if we don't first address the front of this. So if we can get this chest to start to relax and open, if we can get a separation from his rectus abdominis to his rib cage and his chest, we're going to see all of this lift and open, which is going to then allow this back to settle down. The shoulder blades are going to come back to their more proper position. It's going to allow slack in the rhomboids. What a lot of people don't understand, and especially a lot of massage, is that people get face down on the table, they get in the face rest cradle, and it feels really, really great to have that back work. But what that's doing is that's just elongating this tissue. Then they're pulling the shoulder blades away from the spine. Or if we're using a foam roller, and the most common technique for working the back is people lay on the roller like this and then they just roll up and down along the spine. Well, what that's doing is that steamrolling and ironing this tissue out even longer and putting it into more positions than it's not supposed to be. So Chris, if you turn this way a little bit more, we'll talk about what's happening there. So if we take our exercise band, we put it along the spine where the erectors are supposed to go. The more he rounds forward, because that tissue in the front gets tight, the more that starts to take those erectors and it rounds them off of the spine. They actually start to, or off of the rib cage. They start to fall away from the spine and they start to get pulled laterally. All of those rhomboids that connect from the spinous process out to the medial margin of the scapula, those get rounded out and they start to stretch out. So a lot of those trigger points are a result of the body trying to add more tissue to hold on to all of that because it's so stretched out. So if we can get his rib cage to open and lift, we can get his chest to soften and open, all of a sudden these erectors can start to relax and come back into their more natural neutral position. They can actually start to soften and shut down, or not shut down, but quiet down. So if we had a dimmer switch, or the lights on at a 10 all the time when we only need them at a 2, we don't want them on at a 10. Same thing for those rhomboids. Those rhomboids, instead of being so stretched out like this, they start to come back and go to a neutral position, and then that's where we're going to start to see, thank you, you can go and turn around this way, that's where we can actually start to see a lot of the symptoms decreasing because we're actually addressing the problem. So let's go ahead and get right into our chest stretch and opening up the front of the body. Okay, for those of you that have a lot of shoulder pain and neck pain, that's where we're going to next. So what we have to understand about the body is the relationships of the cable system, the muscles, the fascia, from the front to the back side. And what so many people don't understand is that almost all of the back pain, shoulder pain, and neck pain that people are experiencing is actually coming from the structure being too rounded in the front. So all of these cables, the chest muscles, pectoralis major, pectoralis minor, get real tight, they get real short, and what happens to the back musculature and the shoulder musculature is that then it gets too stretched out. So what we're going to do is that we're going to stretch the front of the chest so the shoulders can come back, and then we're going to do a technique that's going to work that shoulder blade and the muscles that attach to the shoulder blade that also then go to the neck to make sure that we can actually decrease our pain for the long term as opposed to always just managing symptoms. So after we've warmed up on the roller, now we just finished with the back technique. Now we're gonna come to what we call our chest stretch. So we are just gonna nice and easily snow angel our arms out to the side. So they're gonna let their arms drop to the floor. And again, this is very easy, very relaxed. And all they're gonna do is they're gonna just snow angel their arms. And as they're doing this, what this is doing is this, as they're laying on the roller, is that it's allowing that shoulder to open up, the chest to open up over the roller. And then it's also, while they're stretching, it's moving that scapula or your shoulder blade against the roller in the back, which is gonna bring that relief to all of those knots and a lot of people call them gremlins or demons in their back, the shoulders, and why they hurt so much. Now, as Christoph and Mary Kate are doing this, you're gonna see that they're gonna have a little bit different range of motion. Not everybody has great flexibility, so we're gonna see that Christoph has really good flexibility, and you can see his forearms staying down on the ground the whole time while he's doing this. That's not most people. Christoph is very flexible in that component. If we come over here and look at Mary Kate, she has a little bit less flexibility, so you can see that her arms are actually up off the ground while she's doing this. It's okay. Wherever you're at is where you're at, and we're never comparing ourselves to another person, or especially on the person to the mat next to us. That's how we see a lot of injuries happen. So as you're stretching, let's say you can only go this far without pain. That's our start point, because as we're doing this consistently, 2, 3, 4 days a week, next thing you know, the next week I'm gonna have a little bit more. They're gonna be a little bit more back. The next week, they're gonna be a little bit more range of motion, a little further back. So again, we're not trying to change everything in one day. Rome wasn't built in a day, and the same thing with our body. If you spent 20, 30 years working at a computer and you're expecting that you're gonna be having nice snow angel range of motion, you're gonna be in trouble. So nice and easy, nice and relaxed with everything that you're doing. Okay, if you're finding that doing both arms at the same time is a little uncomfortable, we can do this with one arm at a time. So the non-working arm, the arm that you're not moving, is going to stay on your abdomen. Then the arm that you're going to be working on stretching the front and working that tissue on the back side is going to be doing the work. And that's going to take a little bit of stress off your body, which you might actually find that doing it one arm at a time, if you're a little uncomfortable or if you're very tight, in the beginning might be more beneficial for you, because now with this arm nice and relaxed, she actually has a little bit more extra fabric or muscle tissue to work with, which means she can get a little bit better range of motion. So if you're finding you're uncomfortable, put one arm on your belly and just do one arm at a time. What we're gonna do is we're gonna go back to our snow angel motion. So my feet are away from the wall just a little bit, leaning against the roller. I'm gonna start with just nice and easy snow angels. And again, what that's doing is that's working that shoulder blade against the roller. And the key while you're doing this is making sure you're relaxed as possible. If you tighten up real hard, it's going to be like a shield that's covering up the scapula. That trapezius muscle is so thick and strong that you want to stay as relaxed as possible to make sure you're actually moving that scapula against the roller. So what I can also do is I can shift over just a little bit, and I can focus one side at a time. As my arm comes up, I can come back down. I can roll as I'm doing that, real easy left and right. I can even bring my arm out and across my body to be able to work that scapula against that roller. Nice and easily, stick or slow is the key, and that's gonna really work that scapula against the foam roller. So again, if I were to switch arms, I just can shift just a little bit. I can bring my arm up and snow angel and really focus specifically on my left side or my right side. Nice and easy, I can come out and across, and that's gonna change which part of that scapula is rotating against or moving with the roller. And that's gonna be our scapula work. Okay, for those of you that are having shoulder issues, we're going to give you a more detailed way to be able to work this shoulder blade, the scapula, all of the muscles that attach this shoulder blade to the spine and to the neck. What a lot of people don't realize is that a lot of that shoulder pain that you have back through here, that monster that some people call it, the gremlins under the skin, really comes from that shoulder blade being too wide and too far away from the spine. So we're going to give you a very detailed way to be able to work that scapula and all the musculature that connects that scapula to the shoulder blade. So Mary Kate's going to lay down on the roller. From here, what she's going to do is we're going to make sure that she shifts her body a little bit. So we're going to work the left side. She's going to shift her body a little bit left, keeping the feet nice and wide to make sure she has some really good stability so she's not falling off the roller. And then the motion is going to come from what she's doing with her arm. So if her scapula is laying on the roller and she's moving her arm around, that's going to really work all that musculature that connects that scapula to the spine. So nice and easy, and she doesn't have to leave it flat. In this piece or in this particular technique, we're really trying to get movement. The key is we're making sure that we keep it nice and slow, nice and relaxed. And again, as she starts moving this arm, this pace is good. If she goes much faster than that, if she gets into this speed, that's going to transition into not connecting with our fascial layers, and you're not going to get as much change that way. So nice and slow, nice and relaxed, she's going to start moving that arm around. She can shift, you know, one way or the other. She can make these little micro adjustments that really make it very detailed and individualized for where she's feeling the discomfort anywhere within that scapula, the upper back, the neck. All those times that you're spent sitting at your computer, or if you're a very active person, those muscles get real stressed and tight. Again, the tighter your body is, the more energy you have to expend to do very simple motions. And at the end of the day, the end of the week, the end of the month, all of that really adds up. That's going to be our very simple yet detailed scapula or shoulder blade work. Okay, so what we're going to do now is we've watched the video, we've taken you through the technique, but I want to show you a little bit more and just review with you exactly why this is so effective. Keep in mind, it's really ridiculously simple, and a lot of people think that because this is so simple, it can't really have the impact that it does. But after working with the roller for 10 years and working with the severe patients that we do in our clinic and our students who've learned the relief through rolling method are sharing with their patients, trust me, you just have to get your clients to do it and you're going to see huge changes. So if we go to the Snow Angel technique or opening up and stretching all this out, the front side, so we can get relief to the back side, that's going to help us actually solve the problem and not just treat the symptom. So if we go back to our stretchy band and we can look at that rectus abdominis coming off of the pubic bone and coming up onto the rib cage as he's laying here, that helps stretch that out and get some space and an opening in the front. As he starts to go through the nice slow chest stretch motion as he's doing this, even if he were to just stop and stay here, this is opening up that pec major, it's opening up that pec minor. As he continues to come up, it gets a nice stretch out of the serratus. So all this tissue is really getting to open. He's going to get more flexibility in his shoulder. This is going to help with thoracic outlet syndrome. It's going to help with neck pain. As this tissue gets tight in the front and it pulls everything down, remember, it pulls the head forward. So as we can see, when this starts to open up, this is a huge key to what we're doing. So don't underestimate the efficacy of this, and really keep in mind how much of an impact it's going to have and how rolling the back and the chest stretch really have to go together to be able to get the most bang for the buck. Okay, so why do we need to roll the back, and why have we seen the back techniques? You can go onto Google, Yahoo, any of the search engines and put in foam rolling. You know, pretty much at every healthcare provider's office across the country, we're starting to see foam rollers in the offices, and it's because foam rolling the back really does produce a lot of change. Now the problem is that we need to make sure that when we are foam rolling, we're supporting the structure properly to be able to make big picture long-term changes. We want to see aches and pains decreasing. We want to see them going away consistently. We want to see them staying away. And that's really why we've developed the relief through rolling method the way that we have, is that not only do you want to roll it so it feels good for a short time period, but we want to see people rolling and having results that are long lasting and sustainable. So let's go ahead and jump right into our relief through rolling technique for rolling the back. All right, the next technique that we're going to do is going to really address the structural problems that happen with the back. What happens with our back tissue is that as everything starts to get tight and it starts to squeeze everything together, the muscles on the back literally start to slide off of the rib cage and come too far to the side. So what we're going to do with this technique is we're going to steamroll all of this tissue, all the muscle tissue, all the fascial tissue back to in the back where it's supposed to be, because it's called back tissue for a reason, not side tissue. So we're going to have two versions of this. The first one is a little more simple and a little more easy, and then as your body gets used to being on the roller and you're not experiencing any kind of discomfort, we can move to the little bit more advanced version. So this first technique, you guys are just going to roll over. You're going to get off of center of the roller just a little bit. You're going to bring your arm over. That's good. That's going to give you a little bit of balance. And again, you can see how Mary Kate here and Christoph are using their feet to find balance on the roller. And then very slowly, because slow is always key, they're just going to inch their way back to the middle. And this is important. The slow is what changes the fascial tissue. It's what repositions all of these fibers so they're where they need to be. Another thing that I really want you guys to pay attention to is, go ahead and do that technique again, is as they come over to the side, you can position yourself, you can move into that position kind of quickly. You don't have to go slow, but once we're doing the actual technique, which is taking the tissue from the sides to the back, that's where we need to go slow. And the other thing is we want to make sure that the head is relaxed on the roller, because what happens is if Mary Kate or Christoph lift their heads up, that tightens everything in their trunk and their torso, and all that back tissue is now really tight, and we're not going to get as much change. So they're going to make sure that their head is relaxed on the roller, and then they're going to use their hand out to the side, and that the feet have a nice width to them, and that's going to help them be as relaxed as possible as they roll back to the middle. They're going to do that a third time. And then nice and easy, rolling back to the middle. Now you can see Christoph and Mary Kate are finishing at a little bit different times, and that's because the difference between a male and a female is that a male has a wider back. And so it's going to take him a little bit longer to move that real estate, where Mary Kate's back is a little more narrow, so she's finishing a little quicker, but she's still going slow. So guys, let's go ahead and do the other side, because we always make sure we work both sides equally. Because if you only focus on one side, even if that's your painful side, you're going to find that you're creating a structural imbalance because we're not lengthening things to be nice and symmetrical. So same thing, they position themselves, they get into position, and then nice and easy, they inch their way back from the side, back to the middle. All right, the more advanced version of this. Now, if you're not having a lot of back pain and you have a little bit more balance and flexibility, we're going to take this range of motion a little bit further. So now we're going to go back to the right side. So now we're going to go to our little bit more advanced version. So now what you guys are going to do is you're going to get positioned all the way over on your sides. And again, this is where time on the roller comes into play. It takes just a little bit of practice. So Mary Kate and Christoph are going to get into position. So now you can see they're all the way over on their side. They actually have the pressure all the way on their hip and all the way on their shoulder. The head can come up a little bit because of the width of the shoulders. It's not going to be able to lay all the way down on the roller for the first part of it. And then nice and easy, they're going to inch their way back to the middle. So again, we're steamrolling in our spine. That's going to allow us to have better posture. But when that tissue gets pulled laterally, it's going to squish and bring everything down. So again, repositioning. Okay, wait just a second. Okay, nice and easy, go ahead. And you're also going to find that if you're left or right-handed, one way on the roller is going to be a little bit more easy in the beginning, just because we're typically left or right side dominant, and that's okay. Consistency comes into play, and the more consistent you are on the roller, you're going to find things start to equal out, and you're going to be a pro. All right, ladies and gentlemen, here we are in our clinic. And remember how in the other techniques we were talking about, we always have variations for everything that we did on the ground. You know, let's say you just had some back issues, it's difficult to get up and down. Let's say you're a little bit older, it's difficult to get up and down on the ground, or it's difficult to get yourself on the roller. Well, we've come up with some amazing variations that you're going to be able to do those exact same techniques in a very easy to do format for your body without having to have the stress of getting on the ground if your body's not ready for that. So this first technique that we're going to go to is going to be the back technique or the erector work on the wall. So after we've warmed up, the body's moving, you can use the warm up from the beginning part of the video. And all you're going to do is you're going to take your 36-inch roller. At home, you're going to make sure you find a spot on the wall where there's maybe not stuff or pictures that you have to worry about. Make sure that the wall is sturdy enough that you're not going to put a hole through a real thin sheetrock or anything like that. You're going to take your roller, you're going to put it right on the wall. Nice and easy. I'm just going to position myself onto the roller. Now, because I'm standing up, I'm not going to have as much pressure onto the roller as I would if I were laying on the ground. So you might not feel like it would be the same thing. Again, remember that that is okay, and just because it's not sore or tender and for sure not painful while you're working, that doesn't mean you're not going to get any less benefit. So what we're going to do is we're going to get that roller, making sure that it would cover from my head all the way down to my tailbone. I'm not going to focus on trying to put my head back because that actually puts a little bit of strain in my body in this position, the way that the back is curved when I'm trying to push on against the wall. So my head is just going to be nice and relaxed. What I'm going to do is nice and easy. I'm going to shift and I'm going to roll my tube on a tube into the start position here. Nice and relaxed. I'm going to put a little bit of pressure into my feet and lean against the roller as I roll back to the middle. And again, we're making sure that we're steamrolling everything that goes too wide back to the middle. So again, I reposition. I can go a little faster for that technique to get started. Nice and easy, nice and relaxed. And the great thing about this is that anybody can do this. Your age, your shape, your size, none of that matters. Get set to the side, nice and easy. I roll my way back to the middle. Okay, then we would just switch the same thing to the other side. Nice and easy, I get to my side and I roll. My arms are nice and relaxed. I can keep them up if I want, whatever feels more comfortable. Just making sure you're not straining real hard. And again, we're not fast-paced rocking. We're getting set to the start position. I lean against the roller, nice and easy. I rotate my body back to the middle. That's going to be the technique for working the back. Okay, so what we're going to do now is, in the beginning, there's a little bit of learning curve to the rolling the back technique, and it feels a little awkward, but once you get it, this is one of the most life-changing self-care tools you could ever teach your clients or you could do for yourself. So what we do, if people are having a hard time on the floor understanding the rolling technique, because again, it's like your body's a tube on a tube, so in the beginning, there's a little bit of a coordination factor that has to happen. So if you find your clients are struggling with this, what we do in all of our classes is that we take people, we put them on the wall right like this. So their feet are out just a little bit from the wall, they're leaning against the roller, they're nice and relaxed, and we just get them to start going through the motion just a little bit, nice and easy, nice and relaxed. Now keeping in mind though that when we get ready to do the actual technique, that you're going to do it that sticker slow speed. That's a very important part to this. So just to get the mechanics or the feeling of the rolling motion, what we're going to do is we're going to have Chris just nice and easy turn his body so he feels his body rolling on the roller. So the roller is actually rolling and it's not him just sliding, trying to scooch on the roller, okay? So then once he does that, he can just roll back to the middle, and then I would have my clients do that 4, 5, 6 times so they can really just feel how they're moving on the roller. And this simple little technique or this simple little method right here, then when we put them back on the floor where they're laying on the roller, all of a sudden the light switch turns on, that learning curve has just happened, and then they can do the technique really easy on the floor. Again, or if you have a client where laying on the floor is difficult, let's say you have an elderly patient where they just don't have that flexibility or the coordination, doing the technique of rolling the back with the variation as you just saw in the video, doing it this way on the the wall is a great variation so they can actually do this. Even though it might not be quite as much pressure, you're still getting all the same benefits for it. So again, we can just have him practice. Now he could go the other way, nice and easy rolling, and then back to center. Good. And then he would do that 3 or 4 times, trying both sides, so he can just feel that rolling, that turning motion that would actually happen on the floor. And what you'll find is that as your clients start to get more flexibility, if it was hard for them to do it on the floor, they do this for a couple of weeks. Next thing you know, they're doing it on the floor and they're getting more bang for the buck, because then they're really using gravity to be the one applying the weight. And the beautiful thing about that is that gravity is always consistent, and that's where you're going to see a lot of really great improvement. All right, so what we're going to do now is we're going to show you exactly why we need to use the roller the way that we've developed the relief through rolling method when we're rolling the back. Before, we were talking about what happens when that front gets tight, it shortens everything up. So let's say we've stretched that out, we've done our snow angels, we've been able to work some of that tissue, the medial border of the scapula along the roller while we're doing our snow angels. Now it's going to be the actual rolling the back technique. So the biggest thing that I want you to keep in mind is that as we've watched the technique already, and we've kind of talked about it in the video, we really need to understand it from a structural standpoint as a healthcare provider and really grasp the concepts of why this technique works so well. And especially in the field of structural integration, this is really one of the biggest things that we're consistently doing in our practices as well as in our classes that we teach on why we need to take this tissue to the midline and not just lengthen it. So remember, if he's laying on his back and he's rolling with a typical technique that we see people using with the roller, he's going fast, he's engaging his abs and his core, and he's working so hard, we're not going to get any change that way because 1, he's under a lot of pressure, he's physically working, which tightens everything up, and 2, as he steamrolls all that tissue, it just supports that deviation of rounding everything forward and in the improper position for the erectors. So we're going to go ahead and have Chris turn around so we can really understand what's happening. So as he's on the roller here, right, and he gets positioned, so now he's in his start position here, and as he slowly steamrolls that tissue from the lateral to the medial planes, that really puts all of those erectors back to their proper position here, because remember, those erectors are slipping off and they're slipping away from the midline, and then the more they slip away from the midline, the more they elongate. So this technique of rolling from the outside to the inside is just, it's changing so much, and it's going to produce long-term big picture changes because you're moving those traps, you're moving that latissimus back to the midline, you're taking those erectors, you're moving them back to the midline. It's helping work and soften the hips. When the hips are more soft through here, that's going to make it so it's not pushing the body so forward, so those erectors aren't working so hard. Again, as the body, go ahead and turn to your right. As the body goes more forward to the vertical line, the erectors have to act like straps to bring the body back. So now the body's playing tug of war. So the more gravity's rounding him forward in the front, it's pulling him forward, the more the erectors get tight. So we have to reverse engineer all that and put that tissue back to where it's supposed to go. So we lift up in the front, the body comes down in the back, and now that we have the slack, now we're going to roll. Go ahead and turn. Now we're going to roll from the outside to the inside, and that's what's going to really help us establish a structure. Thank you. That's actually functional. It's going to establish a structure where we're actually seeing consistent decreases in the aches and pains. We're going to see increase in flexibility because now the tissues aren't locked in a stretched out position. The kyphosing is going to change. That ventral drag and medial rotation of the shoulder girdle is going to decrease. We're going to see major decreases in all of the aches and pains of the TOS and the shoulder pain and the neck pain, and then we're going to see major increases in range of motion, flexibility, spinal function. This really just is life-changing, and I hope that as we've gone through this video, you've really been able to understand what's happening with that. Now, the last thing that I want to talk about is on the videos, you'll see that we don't necessarily spend a lot of time rolling the neck itself, and you'll see 1,000 different ways in which people can work their neck, but what we need to understand is that the position of the head and the neck are determined by everything else that's below that. So what happens is that when people's shoulders round, okay, and we get short in the front. Now the head's not going to stay looking down at this position because the person needs to look straight forward. So what that does to that head and the neck is that shortens, and it dramatically puts a lot of pressure on all of the very fine bone tissue that we have through here. So we see deterioration, we see herniated and bulging discs, a tremendous amount of neck ache, neck pain, headaches. All of these different things are a result of the body not being more open and lifted where it's supposed to be. As soon as that chest opens, as soon as all of this tissue comes back to the back where it's supposed to go, now that head can sit on top of the body and float there where it's supposed to and be in its neutral position, as opposed to it being stuck here and forward. So while we might not spend a lot of time specifically rolling the neck muscles, we need to understand that where the pain isn't necessarily where the problem is at. And by stretching the chest and doing the chest technique in the Snow Angels, by rolling the back, that head position is going to improve itself. Thank you very much. And as that head position and that neck position improves, you're going to see a direct correlation to a lot of the aches and pains, the headaches starting to decrease, if not go away. So I hope you found this information incredibly effective. We know through 10 years of experience, we work with the worst of the worst in our clinic on top of really high-level athletes, and we've been putting this into play for the last 10 years, which is why we want to share this information with you guys. We strongly believe in teaching to fish instead of give a fish, and that's how we're really going to help our clients big picture long term. If you found this video helpful and you find the information valuable, we are offering a 16-hour continuing education class throughout the entire country. We have different cities we're going to. If you go to www.rtrolling.com, you can sign up for a 16-hour instructor training program. That's going to be so much more in depth than everything we just did in this free webinar. We're going to be looking at every area of the body. We have understanding of how the structure works, looking at solving the problems and not just solving the symptoms. It's incredibly fun. You're going to learn so much information that you're not only going to be able to use by using the Relief Through Rolling system, but you're going to be able to take so many of these concepts and put them into play into your practice. And it doesn't matter if you're a yoga teacher, a Pilates instructor, massage therapist, chiropractor, physical therapist, personal trainers. We have all of these healthcare providers, orthopedic surgeons, taking our Relief Through Rolling training classes all over the US and Canada, sharing this information with their clients, and it's just an amazing, fun, good time, and the rolling stuff feels good, yeah?
Yeah, of course.
So on top of feeling good, the changes that it's going to provide your clients with an opportunity to improve their life and have a more vibrant, dynamic, and pain-free life is really, really profound. So thank you very much for joining us. www.rtrolling.com to sign up for a class today.